This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your phone calls on any subject that you'd like to hear about. Perhaps you've had a problem. Guess what? You've been looking every way that you can, under every rock. You've tried, you've applied. Well, here's an opportunity to kind of get a different look on the subject from a non-drug, non-surgical point of view through acupuncture, chiropractic, nutrition, manipulative modes, all kinds of natural therapeutics that maybe you don't know a whole lot about. Anyway, give us a call, 888-630-9625. That's 888-630-9625. Love to have you on our show today and talk about your problems. But as remember, I told you and I promised you that on off weeks for a short period of time, we would continue talking about that brain and how it runs the rest of you, the brain, neurological system of your body, above, down, as they say, and all the things that manifest and show up. And to hear with me today, finally, after much encouragement, and prodding and pushing and poking. And hi, Sue.
Hi.
I brought the boss. So we're finally going to find the biochemical piece of all those things that we're talking about.
Well, at least some of them.
Well, at least some of them. I know this is a big subject. We could sit here and talk about it all day long. But, trying to get you away from my grandchildren is, a job in of itself. It's like you don't want to be on the show anymore.
Well, no, it's not that. I just got lots on the plate.
It's called grandmahood. I got it. Listen, the subject that we're talking about is one that, is getting a lot of spotlight. And people are finally realizing that the body cannot be compartmentalized. And it has to be looked at as a system. And the primary system is the electrical system, or if you want, more specifically, how the brain neurologically, neuroelectrically, neurochemically affects the rest of the body.
Right.
And there's many pieces of that. So, we've touched on this subject repetitively over the years, but I want to focus on it because I want our audience to really understand what happens when that nervous system either is injured or it's stressed or it's chemically inundated with things that, we think that are day-to-day, everyday type of situations. And so that's what we're going to talk about. We're going to talk a little bit about that chemical side of the triangle today and how that affects everything. So, I want to start at one thing because this is a food product that everybody in the world seems to want to consume, 90+% of the population on a day-to-day basis. And they don't think much of it. And there's tremendous controversy, whether it's good for you or whether it's bad for you. And so I want to shed a little light on it. And we'll probably argue about it a little bit here, but that's okay. And what I'm talking about is coffee.
Oh, yeah.
Okay, so coffee is that, having come from a Sicilian background, I smelled coffee, especially espresso, in the house every day of my life.
We all did.
And it was that flavor was great, right? Mm-hmm. But I also know that, and with many of our patients, when they've come in chronic pain, and everything they've tried has failed, and then all of a sudden I said, look, get rid of the coffee, and they look at me like I'm this, throwback from the bowels of hell.
You just asked them to cut their right arm off.
I know. And they, finally they give it up, and 30 days later, they look at me and say, my pain's gone.
Yeah.
It's not bothering me anymore.
And I have so much better energy.
Yeah, I feel great.
Yeah.
So why?
Well, you have to remember it's not just coffee. It's what's in the coffee that's causing the problem. And again, we go back to this, well, how can something that I swallow have an impact on my brain and the way I feel and my energy? Coffee's supposed to be very helpful to focus and energy. There's a chemical class called methylxanthines in them. It's a big fat name.
Methyl who?
Methylxanthines.
Okay, thanks. I wanted you to say it twice.
Thanks. And that includes things like caffeine, which we are all familiar with, but another one called theobromine, paraxanthine, and theophylline. And these are called psychoactive stimulants. In other words, their effect is on what goes on in our head. And this is the connection, this is that addiction that makes us want that coffee every morning.
But they're drugs.
They are.
Just like any kind of other psychoactive drugs that your doctor writes a prescription for.
They hit the same place in the brain.
Thank you.
Absolutely. And they are stimulants, which is why they are so addictive, because anything that will make us focus and have more energy and be able to do things more efficiently is something we want to keep doing.
But isn't there a level of diminishing returns?
Yes.
I mean, you put something into the body, and then pretty soon, I used to tell patients, and I still do, I still do, that you drink a cup of coffee, and it brings you up above the threshold of normal, so you feel great, your head's clear, and you feel like you can do super things. Mm-hmm. And then it goes down, it has a 50% half-life, okay? Mm-hmm. So I think it's 5-6 hours out or something like that.
5 hours later, you still have 50% of it in your body.
So then it continues to crash down. But here's what happens. You have another cup of coffee because you feel that down from that high. Mm-hmm. And then pretty soon that down becomes lower than what it was before, so you have to have another cup of coffee to bring it up. But in addition to that, as we talked about these psychoactive drugs that are in the coffee, and they have an effect, if you will, at tying up receptor sites and causing problems. Mm-hmm. Let's talk about that a little bit.
Well, one of the things just that happens when they tie up those receptor sites and that you have a craving for more and more and more to prevent the negatives are things like anxiety and the depression, the panic attacks, irritability. Now we're talking about the places of the brain where chemicals of the brain, the communicating chemicals called neurotransmitters, are also connected to. And it alters how well those neurotransmitters can actually activate because they've got all this other stuff in there interfering.
They compete for the same sites.
They're competing, absolutely. And so here you've got somebody who's having a problem with focus, low energy, can't think, there may be ADHD, they've got lots to do, there's lots of stress, and they're also drinking all this coffee or tea or yerba mate or worse yet, guarana. And they're also increasing their headaches, their anxiety, their nervousness, their panic attacks.
As a rebound.
So
here's the situation. I want to deviate just a little bit because you said something that triggers a thought process. And a child who has ADD or a learning disability of some sort, doc says, go give them a cup of coffee. Mm-hmm. It'll focus them. And
it does, and it works opposite in children.
It does, and that's the whole point. So we're going to get into this later on in the show because there comes the gut-brain connection. Mm-hmm. And because we know that our neurotransmitters, those things that are supposed to be going to these receptor sites, 80% of them are produced in the intestinal tract.
Right.
And we'll talk to that. But here is a child who has a deficiency. I'm going to use that term, and that's not quite accurate, but a deficiency in these neurotransmitters going into the circulation, into the brain. And he or she is showing the side effect of that, the anxiety, the inattention, the hyperactivity, and so forth. Mm-hmm. And then doc says, well, let's do this. And they give them caffeine. Mm-hmm. Maybe just a little lower stimulation than something like Ritalin. But never the effect of sites, the receptor sites are just the same. Mm-hmm. Right? Mm-hmm. So we're substituting this drug for what should be in there to begin with. We're hyperstimulating the system, and then the body now is becoming more dependent on that hyperstimulation where it should have been normalized by the neurotransmitters.
Right.
Did I get that right?
I think so.
Did I pass?
I think so.
Okay, good. So let's talk a little bit more about...
Can you repeat that?
No. Don't ask me to do anything twice. But let's talk about those other side chemicals a little bit, as far as how that all takes place and why it works the way it does, and why these Theo Bromides and the methyl forms are produced, and why that's important, and why they're being blocked. So what I'm saying to you is this: you have caffeine. Mm-hmm. Okay, caffeine then has these other components. And they're found in not only coffee, but they're found in other sources of foods and drinks as well, anything that has that similar substance. So the exposure to these things, what impact do they have on the body?
Well, like I said, they can cause far-reaching things, not just in the brain and affecting how the neurotransmitters can convey their messages properly or not properly, as the case may be. But they also create all kinds of GI problems in the gastrointestinal tract. They cause some malabsorption problems. They can cause nausea. They can cause irritable bowel. And that can also lead into leaky gut problems where more and more sensitivities start in.
Well, I guess we're back. We're back in the program.
Apparently, had technical difficulties.
That's called technical problems. So I guess we have to be straight up with everybody in the fact that we can take calls and we can talk to you and we can put the fire out in anything you want to talk to, but we are not in studio today. So we're doing a remote broadcast. We are, fortunately looking at sunshine and water and things of that nature, and it's all good, and we'll be back. It's, trying to pull the wool over people's eyes sometimes
never works.
No, it doesn't, because technology being what it, that's why, Sue, that I like a pencil and a piece of paper.
Oh, don't talk to me about this. I'm the original do not put me on a computer person.
Yeah, I know. You're the last of the holdouts.
I am. So, I refuse to move out of the dinosaur age here.
Okay, so let's talk about Theo Bromides. They're
you mean the chocolate addiction?
Yeah, they're an alkaloid. So let's talk about that. We'll make it light and tell people how bad they are.
Well, it's the same category as the caffeine. It's processed through the liver in the same manner as caffeine is. It's milder than caffeine. It has lesser of the negatives, but it is the substance that is in chocolate that addicts people. That is the drug of chocolate. It's not that wonderful taste. It's what that does to us. And so, again, whether we're talking caffeine, heroin, cocaine, or whatever, they're all hitting in the same place of the brain. They all give us that same reward effect, and an addiction is an addiction no matter what it's to. That one just happens to be a milder one, and it's a sort of a socially acceptable one, and everybody loves chocolate, and it has a lot of benefits, the chocolate itself, if it's a good quality, but it does contain that substance that is in the methylxanthine category, and that can be very toxic to people.
Okay, so we're going to come back to that. Again, we beg your forgiveness. We'll try to make technical assistance much better than what it was. But listen to Dr. Tom Roselle live. We're talking about things that affect your brain. Don't go away. We'll be right back.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Listening to Dr. Tom Roselle live in studio, waiting to take your phone calls at 888-630-9625. That's 888-630-9625. Want to remind you before we get back into the program that the Roselle Center for Healing, in conjunction with Caring for Others, a 501c3 Virginia charity, is sponsoring something called Have a Heart, as we do every year. What does that mean? There's a lot of people in our metropolitan community that go without food. They're homeless. They don't have any of the resources to do anything in their life, and some of them go without food. And we try to, this time of the year, to make a difference. What we'd like to do is extend the opportunity to you to help us help them. And what do I mean by that? The Roselle Center for Healing is going to offer something to you in exchange for your help. We will offer to you a complete examination with either one of our chiropractic doctors or one of our acupuncturists at absolutely no charge, at value $225 to $250, and we're going to give that to you as our gift as an exchange for either food, a value at least $50, dry food substances, or money, your choice. You can do either one of them. Call our office at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to join us in helping others and Have a Heart campaign in exchange for either food, dry goods. You can bring those right into the office with your appointment time, and we will take them to Food for Others, which is in Merrifield, Virginia, and they will distribute it to the homeless and those in need in our area. So Have a Heart campaign is being sponsored by Roselle Center for Healing and Caring for Others. Please help us out and help others so they can eat and survive. And we're talking about very basic life-giving situations. Give us a call, 703-698-7117. Bernice, you've been sitting there very patient, hon. How can we help you?
I have a question about oregano oil. I went and put some on a friend. She's 90 years old, and I went and put some on her feet because she had like a... actually, the reason I went to her house is because she had kind of like a cold, so I went and rubbed it on her chest. And then I went ahead and did it on her foot where she had a diabetic ulcer underneath. And she had cellulitis where a piece of meat fell out of the freezer about 7 years ago. She has a big bruise. So
what was the outcome?
In her legs. So I went and put the oil on her, and the swelling in her feet that she had went down. And so she's been wearing her shoes, which she hadn't worn in a long time. So I want to know, oregano oil, does it have any side effects? It seems like it's doing really good for her, you know.
No, oregano oil doesn't have any side effects, Bernice, and it's one that's used for a lot of different things. It's a very strong antifungal and in some cases an antimicrobial. We use it for a lot of different things. Oregano oil also is a detoxifier. If somebody has been stuck on marijuana, for example, for many, many years, if you give them organic oregano, and very concentrated forms, and you give it to them several times a day, and that in conjunction with basil as well. Organic basil and oregano together, they're detoxifiers. They'll clear those toxins and release them, from the body. So there's no side effects. It's not going to hurt them, but in fact, it works extremely well.
It doesn't have any side effects with blood pressure?
No.
No?
Not at all.
Okay.
Nope, it sure won't.
There's a lot of benefits. Her feet have been swollen for years. And each day she puts it on, her feet aren't swollen. So she
the only thing that I would encourage Bernice is this: she may want to take it orally as well. The effect will be more systemic and more far-reaching. Obviously, it does get absorbed into the body from any kind of skin tissue, but the fact is that if you ingest it orally, it'll be a much stronger effect. Locally, use the oil, use the capsules. Now, with any type of herb, long-term use is something that has to be reevaluated because you can become allergic to it. You can become sensitive to it. So I would, without knowing the patient, without knowing the problems and the medical history and so forth, what I would suggest, as long as she's tried it on her own, is that about every 30 days, stop it for a period of about 5 days and then go back on it. That gives the body a break. But if the patient begins to get sick or they get any nausea or they start developing headaches or rashes where it's being applied, then you know it's a problem. So, happy to talk to her online. Tell her to, give me a call. Not give me a call. That's the hardest way to get a hold of me. But send me a note on email at rosellecare.com, and, I'll tell you some other guidelines. But, Bernice, thanks for your phone call. Appreciate it.
Thank you. Bye-bye.
So anyway, Sue, let's get into another piece of the puzzle here called Nightshades. We're coming up against the bottom of the show, and we need to talk about that, set the stage for the next half, because I got some things I really want to discuss with our audience today.
Well, the other thing that can get people really in a problem as far as all kinds of health issues are the nightshades, and that's a group of vegetables. Potatoes, white potatoes, not sweet potatoes or yams, tomatoes, bell peppers and red pepper and crushed pepper and cayenne pepper, but not black and white pepper, eggplant, tobacco, paprika, like I said. Now, here's a couple most people don't realize: Golgi berries and ashwagandha, which is an herb we use a lot to help people with adrenal problems. It only is good if you don't have a problem with nightshades. Golgi berries, especially chocolate-covered Golgi berries, can really get you into some problems.
Patients come in the office, and we do a lot of work to determine whether some people are sensitive or toxic to things through neuromuscle function testing.
Right.
And they say, well, how can I be sensitive to that? And the truth of it is, a lot of these things that they hype as being the end-all and be-all of everything else. There's a lot of sensitivities to them that they don't realize. And just like we got done talking about coffee, you know, we could talk about coffee actually for about 4 hours and talk about the studies that are out there and the pros and cons. But for people who have inflammatory problems, who have blood pressure problems, those things, including ashwagandha and so forth, can rebound and cause very significant side effects.
Well, that's true, and all of these things have chemicals in them that are altered by how we detoxify them through our liver. And if you have genetic predispositions to problems detoxifying things, that's going to make you more sensitive, and just some people are more sensitive to things. The substance that's in a nightshade is called alpha-solanine. And it was identified back in the 50s by a professor of horticulture, Dr. Childers. And prior to the 1800s, nobody ever ate nightshades. They were always considered witchcraft food. About 1950 or 1850, they decided it was good for pigs to eat, but not for humans. And it really didn't become a big part of our dietary patterns until late 1800s. That particular substance is extremely inflammatory to people, both in the guts, the brain, and the joints. We'll talk about that more later.
Yeah, we've got to come back. We have to pay attention to our sponsors. We'll be right back. You're talking and listening to Dr. Tom Roselle Live.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Attend Springtime Allergies with Dr. Matthew Adams on Wednesday, February 18th at 7:30 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're broadcasting live to you. I'm not going to tell you I'm in the studio because I'm not. I'm someplace very pleasant, looking at blue skies and water. But I'm here for you, as we are every Sunday. We make sure that our programs are live and that you have the opportunity to ask your questions, and that's what we're doing today. We're talking about some very interesting subject matter, things that make your nervous system not react the way it's supposed to. We're here at 888-630-9625. That's 888-630-9625. Give us a call. My guest is my boss, Sue Roselle. And finally, we dragged her away screaming and kicking. But, to do that, I had to take her on a trip at a meeting. She got to rest this week. I had to work the entire week. And that's the only way she would leave this avocation that she has, is called my grandchildren. So
You're so bad.
I am. That's what happens. So we're talking about those things that affect the nervous system and cause the perception of cognitive dysfunction, the predisposition to Alzheimer's and Parkinson's and MS, things like fibromyalgia, arthritis, irritable bowel problems, all affecting primary receptor sites, the nervous system. And you end up with chasing your tail all over the place trying to figure out what happened. And we're going to talk about nightshades, or a group of substances that are called anything from solanine to solanase compounds. But before we do that, Michael, you've been very patient. How can we help you, sir?
Yeah, I'm a long-time ulcerative colitis sufferer, and I've been diagnosed with it, and many, many times have been in and out of the hospital and have had bouts with it. But I've started doing my own research because I just can't find a doctor that really knows enough about me or the disease to cure it, because I really think the ulcerative colitis is a result of something else. Now, I can
Michael,
give you some history.
Yeah, I'm going to ask you for a little history. Go ahead. Start with that to make it quick, and then I'm going to ask you things that are very specific.
Okay, no problem. I can nail them. It started when I was about 7 or 8 years old. It comes on every 7 or 8 years, and I heal back 100%, think that it goes away, and it comes back again. Now that I've gotten up in my older years, it's more of a problem than it was a minor bouts of it for a while, and they've gradually gotten worse. I've been on everything.
Michael, in your observation, I want to take it apart a little bit. Your observation of your own self, what are things that seem to trigger it? You say it comes and goes, it seems to go away for a period of time, and then it repeats itself. What happens? Can you ever put your thumb on, this goes on in my life, and bang, I end up with this. These exposures take place, and this happens. Is there anything that can correlate like that?
I have several of those that I think, and some of them are yes, other ones are no. I've had people tell me it's stress-related, but you don't have much stress when you're 7 and 8 and 10, 11, 12, 15, along in that lines. But then I'm also deathly super sensitive, allergic to eggs. And I notice it comes on right after I get dosed up with eggs accidentally. And it's really funny, I've noticed the last couple times when I have a craving for chocolate and I overdo my chocolate intake, it comes on after that.
Yeah, chocolate's one of the things that is definitely related to people who have sensitivity to the colon and will cause not only irritable bowel disease, but syndromes and also colitis patterns and so forth. But let me clarify. I'm going to stick with you a little bit, Michael, because you're touching on an area that most people don't think about, particularly when it comes to children. I'm just going to touch on that. We're going to move forward. Sure. Kids who are young and teenagers have tremendous amount of stress, sometimes perceptually, self-induced, or because they're being suppressed by their environment and things around them, including family and external factors. In our society, we have the unfortunate inability to support children the way they were supposed to. And we go to extremes in how we handle them. The old culture says, a child should be, seen and not heard. New culture is that they allow, kids basically to do anything that they want to do without any restraint. Well, there's a loving, supportive, encouraging in between. But the point of it is that in many cases, you see kids that, because of peer pressure, today's technology is incredible. But going back years ago, if you don't have a family support system, or if you have somebody who is verbally or even withdrawn abusiveness, meaning that they're not involved in life, that can affect you. So I don't want to get into that piece with you. I just want to acknowledge the fact that those things are possible. And, children are not left out of the loop.
Yeah, I've never had any of that growing up that caused my caused the ulcerative colitis.
Okay, so then here we've got some sensitivities. You've already said that you have some sensitivity to eggs. The most common culprits are any of the things that we've been talking about, like the solanase family. Sue said tomatoes and eggs and potatoes and Golgi berries and tobacco, peppers of any kind, including paprika and tamales and pimentos and cayenne and yada, yada, yada. And, you have those things. And then you get into the gluten family, which we know that will destroy the gut. You have gluten sensitivities and you have gluten allergies. And, you're talking about a gliadin antibody that causes the gut to go into degradation. The higher your toxic reaction to gluten, you walk by it and you got a problem. And it can cause the gut to go into not only irritable bowel, but also to colitis, where the patient continues to bleed. When I was an intern many, many moons ago, we found a patient who had been everywhere, and this poor guy, he was about as thin as they could be. He was about 125 pounds, should have been about 185 pounds, and he was having bowel movements anywhere from 30 to 40 a day. Many of them were bloody, many of them were mucus, a lot of cramping, a lot of pain.
Yeah, that's me. That's me. And
I didn't know what I knew today then. And what we found was a combination. You've got to remember, structural, chemical, emotional. When the biochemical system is affected, it will affect the nervous system. When the biochemical system is affected, it's going to affect the neuroemotional system, meaning that in what we're talking about right now, the different receptor sites that are dependent on these things called neurotransmitters, where they produce most often in the gut. Mm-hmm. And Sue, you've talked about this repetitively. Here's a man who's been suffering with these things, for his whole life. You can go into periods of more immune strength, and then suddenly because of life situations and so forth go down the other way.
Right. A quick question. You said this seems to come back about every 7 years. Are you by any chance getting any kind of vaccinations during those periods of time?
No, being allergic to eggs, I'm away from all vaccinations, but I have kind of been doing some research on the internet, and I wanted to get your opinion on this as well, that possibly I had a huge parasitic infection in me that went dormant and then came back. And I've also
that can happen. The eggs will regerminate at certain points.
Yeah, and I've also, now I'm on a all natural because they misdiagnosed what I had a couple years ago, and they dosed me up with all kind of antibiotics and killed everything inside of me, the good and the bad.
Yeah, so you have no protection whatsoever in your gut.
Yep, the doctor now has said no more antibiotics for you for 10 years, and I've got this thing that came back, and instead of going seeing him again and going through what I've gone through for the last 5-6 years, I just started doing it naturally, and it seems to be helping. I'm on what they call a wide-band parasite cleaner and killer.
Right.
But
the thing with parasites is that they get into tissue. They bury themselves deep into the body, and then they lay their larvae. And then even though that you get rid of the parasites, the larvae are there, and they go through germination cycles. And sometimes they can do it monthly because they're worse when the full moon's out. But they can also do it over a period of time, again, dependent on how your body's handling its immunological condition. And when we're talking about the immune system, we're talking about many different pieces of it. You know, it may be affecting the gut may be the manifestation of the symptom process, but the triggering mechanism may be something else entirely. So you have to look at that. It can be neurological. It could be, as you know, we're talking about brain-body. It could be receptor site blockage, inhibition. So those are the things that you have to look at, but you have to look at the body as a system, not as an independent pocket.
Right.
Yes.
And the other thing is, you could have multiple sensitivities now that you didn't have as a younger person, purely because you've had to live for these many years with a gut that's not working. In other words, the villi may be damaged from the egg allergy or from gluten sensitivity, or you may have developed leaky gut over the years, so you have multiple sensitivities that you're unaware that you even have because they don't give you outright symptoms. But at some point, they will all culminate, and perhaps that's where your kickoff is about every 5, 6, 7 years. Being as vigilant about foods as possible is the first clue here. But anytime you have a disruption in the gut, you're going to have a malabsorption. And when that occurs, you're going to have fewer building blocks to heal and decrease inflammation with. So, you know, it's a very complicated process. Definitely parasitic infections can create colitis in the first place, and it can also prolong it and maintain it.
Michael, in our experience over the years, and unfortunately we've seen too much of this, and fortunately we've been able to help many people with it. If we can be helpful to you, you can get a hold of us if you just want to have a conversation, you know, by internet, rosellecare.com. Or even, you know, if you want to come in and have a brief consultation, we can do that as well. But I think your problem has a why is that, and it can be dealt with. It just, you have to find not only the underlying trigger that was probably there years ago, but also the ongoing breakdown in your system, and now that's complicating the condition. So having said that, you know, we're happy to do whatever we can. Give us a call. And Mike, I appreciate your phone call. Please let us know what we can do to help you. Diane, thank you for holding. How can we help you?
Yes, thank you. I just changed my question. I also have colitis. I wasn't going to talk about that. I had another problem. All right. And I'm afraid to actually eat a lot of stuff. All right. I exist on catfish and salmon, and I alternate with asparagus and creamed frozen squash, and I take a lot of vitamins. It seems
okay,
like
so let me jump in real quick. I'm gonna ask you, because I knew what your other question was with your knees, and the same thing that is affecting your intestinal system could also be affecting your knees. You have to remember that every muscle in the body, if you've heard the program and listened to me, that every muscle has an organ system that it communicates with through the nervous system in the body. So, for example, your big thigh muscles that go over the top of your knees, they have a big tendon that goes over your kneecap and then inserts into the leg. Those thigh muscles have to do with your intestinal tract. So when the intestinal system is not working the way it's supposed to, those quadricep muscles, those thigh muscles, are going to misfire, and your knees are going to be unstable. And subsequently, just movement now begins to break down and degenerate the knees. So let's go back to the problem. Sue, you're sitting there, you heard her dietary habits. I know you had a comment because I saw the look on your face.
My comment is we have to find as many foods that are safe for you to use so that you don't keep repeating them, because ultimately you will develop a sensitivity to the foods that you think currently are safe foods. That's a problem to try to do on your own. That's where you need some support with that. Food sticks around in your body for 4 days. That's how long it takes approximately to process anything that you eat. So if you eat something today and then you skip tomorrow but you eat it the next day, you're doubling up on the effect of that food in your system. And eventually, if you have an overload of the same foods time and time and time again, that's a prescription for developing multiple food sensitivities.
Well, here's the thing, Diane. Sue said the food sticks around in your body for 4 days. The thing that is that, yeah, you evacuate the food and it's out and the residue is gone. But what she's talking about is the biochemical effect, the triggering mechanisms in the autoimmune system throughout the body. And the other thing is that we know there are some chemicals that will stay in your system, or the effect thereof, for up to 10 or 11 days, and gluten is one of them.
Gluten, casein, egg white protein, the nightshades we were speaking of, the effects of chocolate, coffee, tea, that sort of thing. All of those, while they all have benefits and good nutrients, they also have a certain level of toxicity. We picked on those particular ones because they're very, very toxic to many people. But any food can have a toxic component that will cause problems, and that's why, and I understand exactly why you're doing what you're doing, and it's a good approach. It's just you need to make sure that you vary it as much as possible among the foods that you know to be safe.
Yeah, I haven't had an attack in about a year now, and that's why I felt confident in what I was doing. And I want to say regarding coffee, I've never had a cup of coffee in my life, and I am avoiding all chocolate.
That's probably a good thing, because they also have, aside from affecting our brain and our nervous system, they also have a negative impact on our arthritis and our joint spaces.
All these things that we were talking about today, from the tomatoes, the eggplants, the potatoes, the Golgi berries, the tobacco, even when you're around somebody who is a smoker, or you smell it on their clothes or on their hair, or some of us are sensitive to the things that we wash our clothes with, and we test them for that, and they neuromuscle function weakness shows up. You have to be very careful with those things. And, we have patients that we have them take big old mason jars, clean them so they're squeaky clean, and we have them lay them in their bedrooms and circulate the air for about 24 hours, then put a piece of saran wrap, plastic wrap on top of them, and then we have them bring in the office. And then we do muscle function testing as we expose them and have them breathe the air. And what we find, interestingly, in many cases, the observation is that they can't hold muscle strength. So we know now they got to clean things out. Thanks for your call, kid. I appreciate it very much. If we can help you, get a hold of us at rosellecare.com. We're coming up to a break. Again, this program is way too short, and we try to do the best we can to answer your questions. But we're here at 888-630-9625. You're listening to Dr. Tom Roselle. Don't go away.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Have a Heart, February 16th through 21st, and join Caring for Others Ltd. and the Roselle Center for Healing in collecting non-perishable food items for our local food bank. Inventory is very low, and our community has many needy families. In appreciation for helping us during our Have a Heart annual charity event, the Roselle Center for Healing offers you a choice of services as a special thank you. Call 703-698-7117 for more information or visit rosellecare.com.
WMAL-FM Woodbridge, Washington. WMAL Washington. WRQX HD2, where Washington comes to talk.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio every Sunday at 12 p.m. on your dial that you're on right now. We'd love to have your conversation, and we'd love to have your input as well as your questions. You can either do it on the air, or you can get a hold of us at rosellecare.com. That's ROSELLECARE.com. And we do get back to you. Sometimes it takes a couple, 2-3 days, but I am actually pretty good at answering emails. We have several more phone calls. We're going to try to get to them. This program, as I said, is like way too short to answer everything that we want to answer and tell you about and talk to you about. But for right now, Paul, are you listening? Paul from Leesburg. How can we help you, sir? We got a couple minutes left.
Yes, quickly. I got 2 questions, but I'll just ask one since there's no time. It's about RA. I got a good friend at work that is suffering from RA, and I know that's a degenerative disease, and I'm completely amazed about how the body's connected together. All learned from you, by the way.
Well, thank you very much.
What can she do?
Lots. Rheumatoid arthritis is a autoimmune condition. And when you have to look at the immune system, you look at the intestinal system, which is 80% of immunological function. You look at the thymus system, you look at the spleen. They all have input, but first the nervous system. And it's right on with what we're talking about right now.
Absolutely. One of the things that you want to be careful about is making sure that the most inflammatory things in the diet, which for most of us are going to whittle down to gluten, which is in the grain products, dairy products, egg products, and coffees and teas and that sort of thing. Even though they all have some value as far as nutrient goes, they also have a higher effect on inflammatory reactions and altering how the immune system works and confusing the immune system, so it's going to go after the joints thinking that joint doesn't belong in that body. And that's basically what an RA is. A lot can be done through nutrient support, through activity, proper activity, eliminating irritation and inflammatory substances. And we see a lot of people with that particular problem turn their systems around tremendously.
Perfect.
You know, there's a situation that, let me back up a little bit, Sue, and I want your input on this. And again, we only have a minute or so.
Okay.
When dealing with any of these things, and particularly dealing with nightshades, it's a group of substances that they give off to called Glycol Alkaloids, but they're found in a lot of different things. So let's say that a person eliminates all the things that they're supposed to eliminate, but they get an animal that eats the stuff. There's a problem. Okay? So potentially there is a problem, but some people are so sensitive. That's where we get these patients that virtually can't eat anything, and then we have to put them on bizarre stuff like, ostrich. And, they're out there free-ranging and so forth. But when you have a domestically grown anything, you end up with a potential problem. So it's such a crossover. That's where, somebody said, well, why do I have to stop eating that? I'm not allergic to it. I'm not sensitive. That's why. And it's because we have these crossover problems from how animals are raised, where they come from, the type of food sources that are available to them, and so on. And it's an unveiling. It's one layer at a time. I wish we could get it in the this a little bit more depth, and it probably is a subject that we should cover more.
It's a whole program.
I know. And, from start to finish, we probably ought to do 2 hours in the office on it one of these days and really get into the nitty-gritty.
But the quick answer is yes, there are things that can be done for this person and get some really tremendous improvements in her health.
And any person like that, anybody that has chronic long-term conditions, you have to treat multidimensionally. You can't just look at one piece of the puzzle. You have to look at all the pieces and treat them together as time goes on. We're at the end of the program. Too short, too fast. We got to end it. Anyway, Sue, thank you finally. And, we're going to do this again, even though your grandchildren are number one in your life. We'll see you next week. This is Dr. Tom Roselle. Bye.
Bye.